Excellencies, ladies and gentlemen, my dear colleague Dr. Margaret Chan, I'm grateful to have the opportunity to address Ministers of Health gathered at the World Health Assembly. At the same time, the Ministers of the Environment of your countries are meeting here in Nairobi at our headquarters for the second session of the United Nations Environment Assembly. This is particularly timely as one of the two main topics selected by our member states for the high-level segment of our assembly this year is healthy environment, healthy people. This means that at the same time, Ministers of Environment and Ministers of Health are discussing how to work better to address issues of common interest and priority. The Sustainable Development Goals are offering us a tremendous platform for working together in a coordinated and integrated manner to improve the environment, the health and the well-being of the populations of our planet. Thanks to the valuable work of the World Health Organization, we understand now that annually at least 23% of deaths worldwide are related to environmental factors. This means that by improving environmental quality, conserving and restoring ecosystems and reducing pollution, we can lower the burden on public health systems. We have had successes already. For example, the global phase-out of chlorofluorocarbons, thanks to the implementation of the Montreal Protocol, is a good example and will result in an estimated $1.8 trillion in global health benefits between 1987 and the year 2060. But the challenges we have to face are of such magnitude and of such urgency that we can only efficiently and impactfully address them if we join our expertise, resources and forces more effectively. We are doing that in a number of areas already, including on air quality and the sound management of chemicals and waste. In March 2014, the WHO released a groundbreaking report that estimates that about 7 to 8 million people die prematurely every year due to air pollution, an extraordinary number. A few months later, governments responded by adopting a resolution on air quality at the first United Nations Environment Assembly held here in Nairobi in May 2014. The resolution calls on governments to do more to improve air quality and mandates UNEP to assist them. A year later, in May 2015, member states also adopted an air quality resolution at the World Health Assembly. The two resolutions are very complementary, with the WHO resolution asking for more health data and involvement of the medical community, while the UNEP resolution calls for assessments and policy actions to support governments in action. This week, at the second United Nations Environment Assembly, UNEP is presenting a report that takes stock of where the world is with taking action to improve air quality. We find that while countries in all regions are taking action to improve air quality, overall the majority of countries in the world are still to adopt priority policies and actions to address this challenge of air quality. Actions such as introducing mass transit public transport in cities, the stopping of burning waste, reducing emissions from vehicle fleets, cleaner fuels, and introducing also clean indoor cooking and heating. Just last week, we learned from the release of the World Health Organization's latest urban air pollution database that air pollution levels continue to rise in many of the world's poorest cities. WHO and UNEP thus have still much work to do with governments and partners to address the key causes for air pollution. Without these actions, we will see billions of more people having to breathe air outside WHO standards. In the area of sound management of chemicals and waste, we also see a very close cooperation between WHO and UNEP. A cooperation that member states would like to see enhanced, recognizing that without addressing the sound management of chemicals and waste, the global community will not be able to address the sustainable development challenges of today, and indeed they will become even greater in the future. Addressing the sound management of hazardous chemicals has been an area of common concern for years, and the resolution you are discussing this week in Geneva makes ample reference to our joint work under the Strategic Approach for International Chemicals Management, SAICM, in particular, but also under the Minamata Convention on Mercury, which is expected to enter into force this year. Do we see that WHO plays an immensely important role? The convention is, in my mind, the first environmental and health convention in the past 20 years. And only through joint support to parties will the Convention have the intended impact on human health and the environment. I would like to thank the WHO and its member states for the role that you are playing and for adopting a resolution on the Minamata Convention at your last meeting of the Assembly. Distinguished Ministers, Excellencies, ladies and gentlemen, Let me also take this opportunity to warmly and sincerely thank my dear friend Dr. Margaret Chan for her active support in making our organizations come closer together. It is our example that will hopefully also assist you and sometimes inspire you to look at how, particularly at regional and national level and in your respective countries and communities, we can break the silos, join hands to prevent diseases and ill health through also addressing better environmental quality and management. For too long, human health and the environment have been treated as two separate agendas. The time has come to bring them more closely together to ensure that policies promote health and environment at the same time. By working together, we can transform the 2030 Agenda for Sustainable Development into a reality, eliminating poverty for the world's poorest people while living healthy lives on a healthy planet. The fact that our two assemblies happen by coincidence to be taking place in the same week in two different UN headquarter duty stations is perhaps also a reminder that while we may operate in parallel governance platforms, it is our way of working together and our way of joining the agenda that can be the greatest promise to make the 2030 Agenda for Sustainable Development more than just a set of goals, but a different way of working. Thank you very much, and let me also say that while I have been given the opportunity to address you by means of this video message today, Margaret Chan will also be addressing the environment ministers of the world with her message. This is the way we should be working. Thank you.